my name's Emily. I'm going to be a nurse practitioner taking care of you. Can you give me your full name and date of birth?
Bajan Anthony Duran, 3/22/91.
Awesome. Can you read the release statement for me?
I, Bajan Duran, voluntarily give Maryville University permission to record my image and or voice and grant Maryville University all the rights to use this recording in any medium for educational or other purposes that support the mission of the university. I understand that the following information will be gathered by a Maryville University student as part of a course assignment. I give my express consent for this information gathering and physical assessment to be filmed and posted in the student's course shell for access by faculty and students at Maryville University. I further acknowledge that since the recording is for educational purposes only, the information is not meant to be diagnostic. Therefore, Maryville University, the faculty, staff, and students are not considered liable. The recording will be deleted by the student and any other devices as soon as it has been reviewed and graded by the instructor.
Perfect. Can you perform a room scan? Okay, I'll start by washing my hands, entering the room. So for the skin portion of the assessment, I'm just going to start with inspection, look over all of the skin, noting any abnormal skin cancers or lesions, any rough patches, noting that the legs are warm, they're dry, there's no areas of abnormality there. I'm going to go up to the scalp, look at the hair distribution, note any patches or lesions. The texture is normal, the distribution is normal. Any pain when I touch?
No.
Are there any areas of skin that are concerning to you? Okay. Color is good, normal for ethnicity. Same with this side. The fingertips don't reveal any clubbing or cyanosis on either hand. Do you mind if I take your socks off?
Sure.
Okay, the feet are also normal in color. The toenails don't reveal any clubbing or cyanosis, so the skin looks great. I'm going to go on to my abdominal assessment. I'm going to start by inspecting the abdomen, noting the color of the abdomen. There's no cyanosis noted, no obvious masses or lesions. I'm going to move up to the head of the bed and look at it at a different angle. Also noting any masses, and there are none. Is there any areas of tenderness to your abdomen?
No.
If there was tenderness, we would assess that part last. So for the abdominal assessment, you'll approach the patient on the right side. After the inspection is complete, you will move on to auscultation. If you don't do this first, then you may, during palpation, you may elicit false hyperactive bowel sounds. So start in the right lower quadrant. And you'll listen in each quadrant. You should note 5 to 35 sounds per minute. But in order to rule out bowel sounds as absent, you would need to listen in each quadrant for 5 full minutes. And then with the bell of the stethoscope, you're going to listen over the liver for any hums or thrills. And then you would do the same for the spleen. Next, you would move on to the aorta. Listen for any pulsations. Next, the renal arteries on both sides. Down to the iliac arteries. And then down to the femoral. Okay, great, the inspection portion is done. So then you move on to percussion, and you would percuss the entire abdomen in all of the quadrants, noting you want to hear tympany. You may hear areas of dullness over bony prominences or organs. And then you're going to go up and percuss the liver and the spleen. And then to determine the size of the liver, you move up till the tympany turns to dullness, which is right about there. And then you start at the 6th or 7th intercostal space and move down, where you hear dullness tenderness about right there. And that's how you can determine the size of the liver. And it should be about 6 to 12 centimeters. And then you would do the same over here on the right side for the spleen. And it should be dull. Perfect, which is normal. Okay, and then you start with light palpation. And you're just gonna palpate all through the abdomen. Any tenderness?
Nope.
There's no masses noted. Okay, and then you move on to deep palpation. Again, noting any masses or if the patient reports any pain. Okay, you're gonna have the patient take a deep breath. Can you take a deep breath for me? And you inspect the liver here. Okay, you can let it out. That's the Murphy sign. If there's any pain during that, it could indicate cholecystitis or gallbladder inflammation. And you're just gonna palpate the liver border. And then you're gonna do the same over here for the spleen. If there's any pain, it could indicate splenomegaly. Any pain there?
No.
Okay. And then you're gonna palpate for the kidneys. You're more likely to feel the right kidney than you are the left, but it's not uncommon not to feel either. And I don't feel either one, which is totally normal. Okay, and then you're gonna move on to the McBurney's point, which is right here in between the sacroiliac joint and the umbilicus. And so this would be the McBurney's point, but the Rovig sign is whenever you press on the left side, if it causes pain over here at the McBurney's point, it could indicate appendicitis. So when I push here, does it cause any pain?
No.
Okay, awesome. So now I'm going to move on to the psoas sign, which also could indicate peritonitis or appendicitis. So I'm going to have you lift your right leg, and I'll hold it. And can you try to push up against my hand? Okay, great. Does that cause any pain? Awesome. And then I'm going to do the arbitrator sign. So I'm going to take the patient's right leg and rotate the hip. Does that cause any pain?
No.
Okay, awesome. Thank you much.